Now to the Health Secretary's position on the new guidelines. Kathleen Sebelius put out a statement today saying, quote, "Our policies are unchanged." So I asked the Secretary what women should do.
Our recommendations really are do what you've always done. Read the task force report, but then talk to your doctor.
Are you refuting the recommendations by this panel?
Well, we're not refuting them. It is one panel of scientists and health officials who have actually waded into an area where the recommendations have gone back and forth for years. So we think this is one more piece of evidence. It should be reviewed. Everybody's health history is different. Everybody's body type and family history is different. And those become the critical factors when you're looking for breast cancer.
Well, doesn't this panel fall under the purview of the Department of Health and Human Services, which you run?
Actually, it's an independent group of scientists and advisors, so they don't work for HHS. They are appointed independently. They are doctors and health professionals who actually look at the evidence, make recommendations, but they have no policy-making authority. We make the policy, and we wanted to put out the statement today to first clarify that no coverage changes will be coming, that Medicare will continue to pay for mammograms, Medicaid will continue to pay for mammograms, and frankly, I'd be stunned if private insurers change any coverage decisions.
Why would you be stunned? I mean, how do you stop insurance companies from using the panel's recommendations that there's no blanket recommendation for women starting at age 40 to get a baseline mammogram? Why would you think that private insurers won't take advantage of that and stop covering them?
Well, at least the statement issued today by the health plans indicated that if there was a doctor recommendation that a woman have a mammogram, they were likely to follow it. So I'm taking them at their word. I hope that's the case. What we know is that mammograms can be very effective.
Republicans are already out there saying, let the rationing begin. This is what happens when bureaucrats make your health care decisions. What's your response to that?
Well, it's unfortunate that once again the attempt is to, first of all, skew the data, and secondly, to make this a very partisan political debate. This is a panel actually appointed by President George Bush, folks who have been on this group for a long time, who were given the job of looking at a variety of services and making recommendations based on the science. That's just what they've done. They don't make policy. They won't make policy.
Really sounds as if you're trying to distance yourself from them.
Well, I think, Katie, what's important, knowing that the American Cancer Society has a set of recommendations, the Komen Foundation has a different set of recommendations. There are patient advocacy groups working on cancer who have supported this panel's finding and others who disagree with it. So we need to continue to do research. We need to look at the best evidence. But most importantly, we need women to talk to their health care providers. We need them to have an individual conversation on what's best for them at age 30 and 40 and 50 and 60.
Kathleen Sebelius, Secretary of Health and Human Services, thank you so much for your time.
Good to talk to you, Katie.